Good day, my dear friends, and welcome back to my channel once again to know more about pediatric medical insights. Today, we will be discussing in short about tongue tie. So, what is this condition which is called as tongue tie? Tongue tie is a condition that is usually present since birth. So, normally, what happens is the tongue is usually attached with a ligament to the floor of the mouth. Sometimes, in some children, that ligament is thick and short. That is the main reason why there is restriction of movements of the tongue. Sometimes the tongue cannot be lifted up to touch the roof of the mouth. This will cause certain difficulties in spelling certain letters like la, na, ta, ra, etc. So usually this condition is seen in newborn children whenever they come for vaccination. When they come for vaccination, when they cry aloud, then we can see the movement of the tongue that is not appropriate. This is when we diagnose tongue tie and immediately do the corrective steps. In older children, sometimes there could be problems with the speech. So certain letters which I have mentioned earlier cannot be spoken properly. Usually, diagnosis is very simple and clinical. There is no laboratory test to diagnose this particular condition. Now, what is the treatment? How do we deal with it? A minor surgical procedure is done which is called as frenectomy. So this frenectomy involves cutting of the ligament and releasing the ligament so that the tongue can move up and down freely. And in some cases where the ligament is quite short and thick, frenuloplasty can also be done. This is a more detailed procedure. And what is the follow-up care that we usually tell the children? So oral hygiene is of utmost importance in infants, and in older children, sometimes they need speech therapy because this condition is not diagnosed early in life, and later in life when this condition comes out and the surgery is done, and probably after 5th year or 6th year when the surgery is done, by the time the speech is acclimatized, so these sort of children might require some sessions in speech therapy. So thank you. Please be mindful for tongue tie and report to us immediately. Thank you.